afternoon, everyone. My name is James Quattrini. I'm a licensed acupuncturist at Align Modern Health. Today, we'll be talking about allergies and how we treat them with Chinese medicine. Okay, so Align Modern Health is one of the top integrated clinics in the Chicagoland area. We have 18 clinics in the area. We have several different modalities. We have chiropractic and physical medicine. So we have adjustments as well as exercise to take home, as well as massage therapy. All this is very good for physical pain. With acupuncture, we can definitely treat physical pain, but we treat a lot of different issues, definitely stress, anxiety, infertility, digestive issues, etc. Not only do we do acupuncture, we also do herbal medicine, cupping, and moxibustion. We also have a functional medicine and clinical nutrition team. These people can also treat a wide range of issues, but they have very strong focus on digestive issues as well as autoimmune issues. A little bit more about myself. I'm a licensed acupuncturist at Align Modern Health at the Killdeer and Mount Prospect locations. I have a Master's of Science in Oriental Medicine. I obtained this in Portland, Oregon 2 years ago. Before I started practicing Chinese medicine, I studied finance at Michigan State University. I can treat a lot of different issues, but I have a strong focus on physical pain and sciatica, digestive issues, mental health such as anxiety and depression, post-COVID issues, allergies, which we'll be talking about today, as well as autoimmune conditions. So what are allergies? Allergies are immune response. A foreign substance enters the body and then antibodies are produced. Then in turn, we get symptoms. In general, this is a good thing. When it comes to the cold or the flu, these symptoms are not glamorous or comfortable, but they do indicate that the body is working, and that is how the body fights off infections. However, in the case of allergies, it's usually more of a false alarm. Bells and whistles are going off when they really shouldn't be. What are some common allergens? Foods such as nuts, pets, insect stings and bites, drugs, mold, plants. I'm sure you've heard of pollen. That's a very common environmental allergen. Metals, as well as latex. There can be many different symptoms, but here are some very common ones. Watery eyes, sneezing, runny nose, rash, swelling and inflammation, tingling, and wheezing. So what is the cause of allergies? There's really no clear reason why some people have allergies and others don't. There is a known genetic component, but however, when it comes to a specific allergy, we're not exactly sure. Someone in the family could have a shellfish issue. Somebody else could have a pollen issue. We're not sure what the rhyme and reason for the specific allergen is. And each person has different triggering factors. If your body is imbalanced and your immune system is down, this can have a reaction to anything from the outside world. Stress. Whenever we have a lot of stress, our body isn't functioning at its best. We can get more pain and inflammation. It affects our sleep, and it also affects our immune system's ability to function the way it should be. Diet. Whenever we're not putting good quality foods into our body, we're not going to have really strong internal health. Also, in turn, this can weaken our immune system. You may have heard of anaphylaxis. What exactly is it? It's a very severe systemic response, and basically our immune system is just releasing a tremendous flood of chemicals into the bloodstream. The symptoms can be shortness of breath, it's very severe, decreased blood pressure, a loss of consciousness, a weak pulse, also very rapid, as well as nausea and vomiting. Basically, this is very severe and can cause you to go into shock, which is your body not functioning. It's life-threatening, and you very well could wind up in the hospital. There is also the EpiPen, which we'll be talking about in the next slide, which can be an effective treatment as well. So what are some common treatments for allergies? Here we have four methods listed. 3 belong to Western medicine. The 4th is what we'll be talking more about today. So medications, antihistamines. When our immune system is fighting infection, it is releasing histamine into the bloodstream. What do antihistamines do? They basically turn these off, and this in turn turns off the symptoms that are bringing us into clinic. Corticosteroids. These are good for reducing inflammation. Nasal decongestants. Sometimes when you have issues, when your allergies are causing issues in the nasal area, it can be difficult to breathe. The nasal decongestants really go in there and open things up, making it easier to breathe. Important to know that all 3 of these, they are not a cure. They are about managing symptoms. They can be very effective for managing symptoms, but you will need to take them whenever the symptoms arise. Immunotherapy is basically the vaccination version for allergies. So there you inject a very small dose of the offending allergen into your bloodstream, and this can reduce your symptoms. This can also be very effective, but it is not a cure. It is just symptom management. Epinephrine, or the EpiPen, as just mentioned. What this can do is reverse the symptoms of anaphylaxis. So all those chemicals released into the bloodstream, the shortness of breath, the decreased blood pressure, it can reverse those, helping your body pump blood where it needs, and making it easier to breathe as well, and reversing that flow of chemicals that's in the bloodstream. Finally, alternative care, acupuncture, herbal medicine, also diet and lifestyle medications that you can do at home. So first, we're going to start with acupuncture. And actually, we're going to do just an overview of what Chinese medicine is trying to do when it treats allergies, or really anything else. Chinese medicine is patient-centered as opposed to disease-centered. Disease-centered would mean that you are basically diagnosed based on the symptom picture that you're bringing into clinic, and then given a protocol based on those symptoms. The treatment is not tailored to you as an individual. In Chinese medicine, we have a root cause and we have branches. Branches are basically the symptoms or the manifestation that are bringing you into a clinic, while the root is the underlying cause that is allowing those symptoms to occur. How do we determine the root? We have a variety of diagnostic methods, but a very good overview of what could happen is when we feel your pulse. We have different positions. Two people could come in with nasal congestion, but when we feel their pulse, somebody might have a noticeable weakness in the lung position, while the other patient might have a very noticeable weakness in the spleen position. Therefore, the treatments would be different, even though they come in with maybe an allergy diagnosis from their PCP, as well as a very similar or the exact same symptom picture. What we're trying to do is restore balance in the body. So a very simple way to think of Chinese medicine is that there's excesses and deficiencies. What we want to do is clear those excesses and strengthen deficiencies. So if there's a lot of nasal congestion, we want to do a treatment that really clears out the nasal passages so it makes it easier to breathe, but then there's some underlying deficiency or weakness in the body that allowed that blockage to occur. And then we want to strengthen that. What we want is free-flowing energy moving through the body. When we don't have free-flowing energy, then we basically have some kind of disease or imbalance that's causing us to have symptoms and come into clinic. So how does acupuncture help us, basically? Acupuncture points are near nerve bundles. So when we insert the needle into your skin, what we're doing is really stimulating the nervous system. This can decrease stress levels. And here we don't just mean emotional stress of feeling overwhelmed. We also mean any kind of inflammation or your body having reactions, basically a stress response. By working with the nervous system, we can decrease the stress response. Promoting blood flow. I just mentioned free flow moving energy. When we insert acupuncture needles into your body, we're building blood, we're moving blood, and we're moving oxygenated blood to an area that it wasn't getting to before, which allows the body to heal. This can reduce inflammatory responses. Also, when we're working with the nervous system, when we're moving that energy and that oxygenated blood, this can increase your immune system's ability to function the way it should be. So what we're trying to do is we're working to harmonize and strengthen the body, but working with its own resources and helping it return to balance. Homeostasis in this regard is basically living life without symptoms or pain. So how tiny is an acupuncture needle? Going from left to right, we have this chart is most thin on the left, most thick on the right. The acupuncture needle is the most thin. This third needle right here is a medical syringe. I always tell my new patients that all the needles we use are thinner than anything they've experienced on the Western medical side. When we insert an acupuncture needle, frequently you don't feel anything. Sometimes it can be a little pinchy, but usually it's not. You might feel a dull, achy sensation. This is what we're looking for. This really means we're accessing that chi or energy. Then we're really working with the nervous system, really helping the body heal. After all of the needles are inserted, most patients find their acupuncture treatment to be very relaxing. Herbal medicine. So under formulas, we have time-tested combinations. It is very possible that when you go into clinic that you can receive a formula that is completely unmodified, that was recorded in ancient texts 2,000 years ago, will be the same herbs and the exact same dosages. Something to know about how we do formulas. So very commonly somebody might ask the question, what's a good herb for this? Or what's a good herb for that? That's kind of a difficult question for Chinese medicine practitioners. We really don't do single herbs. It can happen on occasion, but it's actually quite rare. We're looking for balance. What I mean by that is there's different types of herbs, and some of them are food grade, and also some are more medicinal. If they're medicinal, that means if you drank them in large quantities by themselves over periods of time, it could be very harmful to the body. What we want to do is balance the formulas by combining those herbs. When we combine medicinal herbs with food grade herbs that are warming and very protecting to the body, this allows us to drink the formula safely over time, and it moderates the potentially harmful effects of the stronger, more potent herbs. Also, it's important to know that a lot of our formulas and the way we structure them, it'd be very difficult to find anything in the supplement aisle at the grocery store. We can prescribe herbs in different ways. At the clinics, we have tinctures. Those are very effective. There's also pills. These can be very effective. The most typical, most common is granules. If you're not familiar with granules, just kind of imagine a powder. You'd get a bottle. It would come with a little spoon. You do about 3 or 4 scoops. You'd add some hot water. You wouldn't need to fill it all the way up, fill up a whole mug of water. You would just need about 1/4 of a cup. And you'd let it just mix for a little bit and then go ahead and drink it. Take it about twice a day. This is very effective and very easy. What would be most effective frequently would be what we call bulk herbs. And this would be if you actually went to an herb store and actually, bought cinnamon twigs or licorice root, and then you'd have to cook it. You would receive instructions on how to prepare them properly. But this would be most potent, but also takes the most work. So it's really a good idea to just start with granules so it's quick for both sides. These next 2 points, we have resource production and freedom from obstructions. Just talked about this a little bit about strengthening weaknesses. This is what resource production is. So basically, I mentioned there could be a weakness in the lung position or the spleen position. What we would do is give an herbal formula that targets that weakness and makes it stronger. Herbs that would fall under this category might be ginseng or astragalus. Freedom from obstructions. So basically, whenever we have an excess or buildup and we have runny nose or sinus congestion, that is an obstruction, and we would want to have a formula that targets that area. So we would provide a formula that has herbs that go up to the face and really moves and clear things out. It's also important to note that we can go other places. So if you have a lot of joint inflammation, discomfort, we have herbal formulas that really get to the joints and move and clear things out. Also, another example, this is a little different, maybe more of a gynecological issue, but if you have a lot of blockage in the pelvic area, we have herbal formulas that go and circulate and move there. So we definitely have a target approach, and it's also important to know that if we're using herbs, it could be a 2-formula approach. So what we likely do is clear the obstruction first and then move into more of a strengthening process afterwards. The strengthening process would take more time. Possibly, you could be taking that form for about a month. Freedom from obstructions or clearing excess, that would be much quicker, probably a week or 2. So here we have a list of 6 formulas, and we have these at our clinic. These are in the tincture form that I was just mentioning, and we are no way limited to using these for allergies, but these are things that could definitely be helpful. So just a quick overview, if you see this formula, Pneuma and Xanthi, these formulas would fall under the clearing excess category. Xanthi is more for your sinuses. Pneuma would be if you had some phlegm in your lungs. Then formulas like Restore and Basecamp, those are more about strengthening the body. Then if you look at Grace and Ease and Allergy, those are a little bit different. They're actually kind of a combo. They have some excess abilities and they also have some strengthening abilities. The formula will not be as potent when you combine it like that, but for the appropriate person, it can also be very effective and the right direction. And also, as I just mentioned, it's very possible you would be on one of these formulas first. Then when you move on to more of a strengthening phase, you would be on a second formula. So what are some things you can do at home? So if we look at the first 2, avoid cold foods as well as incorporate something warming. Notice that these are kind of opposites. We have cold and warmth. When it comes to cold, that frequently kind of indicates that we're getting a blockage or stagnation, or we'd have to clear the excess that I was just mentioning. So a lot of people think that salads and raw vegetables, they might think because they're vegetables, they're healthy, or because they're not cooked, they're getting more nutrients from them. From the Chinese side, that's actually not true. We believe that you get more out of it. It's better energetically, more moving, more warming if you cook them. And also if you cook them, it is known that they're easier to digest, absorb, and get more nutrients from them. Also, cold drinks also can cause stagnation. So if you are manifesting any symptoms, you definitely want to avoid these cold foods. And also, if you know that you tend to have allergy symptoms during allergy season, maybe definitely starting to mitigate a little bit before would be a good idea to help prepare. Also, I don't want you to get scared and think that you should never have these things, but just know that having them frequently might not be the best. And also, if you do have them, maybe having a warm beverage with them would also help digest them better. So something warming, ginger, cinnamon, nutmeg, cloves. When it comes to warmth, that's all about circulation. The body needs to be moving and transforming things. If you incorporate these into your diet, really all times of year, but especially if you're having any symptoms, this will help mitigate the problem. Eat with the seasons. Chinese medicine is all about rhythms. If you're wondering how to be healthy, something to do is really look where you are and what season is. That way you're eating local foods that are growing at the current time. This is definitely a good thing to be doing. And also now that's fall, we know that pears and the gourds are starting to grow. So now it's a good time to cook them and enjoy them as part of the season. Incorporating balance building exercises. Western exercise is definitely good for you. The intensity, the movement, it's very good for burning calories, staying healthy, being stronger. It has its place and you should continue to do it, but it doesn't do everything. Yoga and Tai Chi are much slower. You're working with the breath, and that way you're working with the nervous system. There is a tremendous amount of health benefits that come from a yoga or Tai Chi practice. Definitely good for the joints, but also known that's good for emotional issues, anxiety and depression. Also known to have digestive help, and we also know that it strengthens the immune system. So if you have symptoms, you might want to start doing some yoga or Tai Chi, but again, it is good to prepare. So if you know that you're having allergy symptoms, you might want to increase your practice maybe 2 to 3 weeks before allergy season comes to see if you can be stronger in preparation for the upcoming season. Okay, everyone, I just want to thank you for joining us today. We're going to do a Q&A right now, but I just want to let you know we also have free 15-minute consultations at all of our clinics. You can schedule these by calling this number right here or by visiting our website. Our clinic managers will be happy to help you get set up with the practitioner at your local clinic. Also, acupuncture does bill insurance these days. We take all of the companies listed below. However, it is important to note that I know the plans can be a little confusing. So do know that if you call our clinic managers, they are happy to run your information, find out what your benefits are. Okay, I am open for questions. Okay, I'm not seeing any questions, so I'm going to go ahead and wrap up. Thank you all for coming, and I hope to hear from some of you at a consult.